evening, everyone. A new year and a new round of Open Mic Next in Health series events here at the wonderful Novartis Pavillon. I'm really excited to be back. I'm really excited to be looking at the full audience, and I'm even more excited to be listening to a wonderful panel of speakers tonight discussing about issues and opportunities of health tech investing. I'm curious, are there any startups in the audience tonight? Looking for investment? Quite a few. Early stage, later stage? Okay, yes, so please make sure to ask your questions during the session. My name is Rael Schneider. I am community manager at Switzerland Innovation Park. Our park Basel area is part of the network of science parks of Switzerland Innovation all over Switzerland. Our site here on Novartis campus, we have an office space here where we host around 30 startups and companies in digital health. This is a co-organized event. We do this together with DayOne Healthcare Innovation. Normally, I'm joined here on stage by my colleague Anca Del Rio, but today she changed roles and she's going to be the moderator of tonight's session. DayOne is an open innovation platform for digital health and medtech. Before Anca joins me on stage, a few words. You are most welcome to interact with the panel with Anca by using Mentimeter. You see the QR code here on the page. You also see it if you're joining online. And for everyone on site, please also make sure to ask your questions here live. I'm going around with the microphone, so you can ask your questions. But now, without further ado, Anca, can I welcome you to the stage?
Thank you, Rachel. Thank you very much. I'm going to jump directly in my new role, taking it very seriously. Hello, everybody, and welcome back to those of you who joined us in 2022. Welcome aboard for those of you who are new to the Open Mic Next in Health event series. We're doing this as part of the co-curated event series, as Rachel mentioned, with Switzerland Innovation Park Basel area and DayOne. This is the third edition, actually, and I will take this opportunity to mention to you, as being the first event of this year, is the third year in a row that we are actually hosting Open Mic Next in Health series in the Novartis Pavillon, the second year in a row. But due to the high demand and the good success that we had in the past years, we are now actually kicking off 2023 with the series. And with this, no further ado, I would like to welcome on stage the amazing speakers who are going to debate a very controversial topic these days, health tech investing. Is it a boost or is it a bust? So I would like to welcome Christoph Kausch from MTIP, where he's the managing partner. Welcome, Christoph. Up next is Daniel Dillinger, investment manager at Redalpine. Welcome, Daniel. And of course, last and not least, Steffen Achenbach, Managing Director from DRX Capital Novartis. Welcome. And now, as we were good and well accustomed to last year, I would like to give the floor, since this is an open conversation, an open discussion, and the opportunity to our speakers to actually pitch themselves, as we usually look at the things the other way around. I will start with you, maybe Christoph. Would you like to tell us a few words about yourself so that I will not introduce you more? You will have the time to pitch.
Absolutely. Welcome, everyone. And let me just say some words about myself before I move on to MTIP. So originally, I'm actually a mechanical engineer. I wanted to develop cars at BMW. And then driven by a topic of innovation, I was working part-time at the innovation management department, which then led me also to take a stint at MIT in Boston for my studies. And surprisingly, thereafter, I got an opportunity for a PhD in St. Gallen. I thought, well, an engineer, what should I do there? I thought maybe it's a nice story to do something else before working at BMW. Then I started my PhD in St. Gallen, still focusing on technology innovation management from a business point of view. And then for my PhD topic, I got good opportunities to focus on healthcare. And that was a topic that started to excite me. Additionally, I got a scholarship to finish my PhD at Harvard Medical School, Harvard Business School, and since then stayed in the life science healthcare area and working then with McKinsey on private equity, specialized in private equity and life science, stint at Syngenta, and then thought actually in Basel, everything is focused on biotech, pharma, or there are some other funds focusing on medtech. But what about digital health? What about the revolution that is going to happen? I didn't see any fund really dedicated on it. And that was a point in time when I said, well, we need to change it. And that was actually the idea and thought process of founding MTIP. Company I created end 2014, and since then working on investments in digital health, connected medical devices, and tech-enabled healthcare services. We're actually not only the first pure play sector-focused fund in that area in Europe, but also by now actually one of the largest funds, managing 300 million just dedicated for health tech. And we do invest from Finland down to Israel without strings attached, can identify the best startups in that area. And with startups, it's also a definition of what we mean. So typically for us, it means they've already achieved roughly 5 million in revenues. And that's when we start investing in them and help them, the companies, to further scale up across Europe as well as internationally. Without boring you too much, but that's MTIP, that's what we like to do. We have a dedicated team of 18 people just focusing on health tech, and very much looking forward to an exciting discussion today.
Wow, that's fascinating. Thank you so much, Christoph. This is quite a journey, I have to say. And it's always fascinating, I think, to learn the story behind the investors actually in health tech, which we know it's quite a particular field in comparison with so many others, and to see we actually have engineers in the background who are actually the investors. And further on, we will learn also about the medical doctors who converted into engineers also to join this dedicated field. Daniel?
Yes, good afternoon or good evening. I'm Daniel, investment manager at Redalpine. I start the other way around. For those who don't know Redalpine, we are a Zurich and Berlin-based early stage fund investing in tech, life sciences and health tech across Europe at seed series A stage. Redalpine is currently in the process of closing our 7th fund. Currently, we are managing over 90 portfolio companies and roughly 1 billion assets under management. Personally, as already mentioned by Anca, I'm a medical doctor. I graduated from med school a few years back at the University of Zurich. Then did clinical research in the field of ENT at the University Hospital in Zurich. Started a residency in general surgery. With the goal to become an ENT surgeon, but after a short stint in the hospital environment, I realized that it will be tough for me to work for the next 40 years in that environment. And main reason for that was that I felt that while medical progress is pursued in healthcare, general process innovation is not. And I tried to change that. My boss basically told me, we're doing what we're doing since 40 years. And for me, it was clear that, it will be tough for me to work in such a system. And I thought this this organization needs to change with pressure from the outside. Startup supply, at least at that time I thought startup supply pressure on the system. And what do you do as a medical student or as a medical professional with limited access to the startup ecosystem? You join a venture fund to get an overview about what's happening in the health tech space. And that's what I did 6 years ago. Haven't left. It's an amazing job. And I focus purely on health tech. For us, that means diagnostics, medical devices, digital health, digital therapeutics. And I mainly look at these companies from an end user or from a professional perspective. And that's also, my main approach. When I'm convinced with the product, I'm also convinced that, I can push that deal through the IC. My personal role or how I see my role here as a medical doctor is basically I think we need to build a bridge and connect cultures between the fast-pacing tech world, aiming for radical disruption, and the healthcare world, which probably prefers gradual innovation than pure disruption. And that's, I think, the role we play here as investors to some extent, at least. Yeah.
Very interesting, Daniel. Thank you so much. There's definitely a very promising contribution you're bringing, also with your role at Redalpine. I'm wondering, Steffen, what about the life sciences industry, and how does this play off for you?
Yeah, thank you.
A few words.
It's interesting to see with two physicians on stage, and it already, I think, tells a lot about the environment that you bring physicians on board of venture capital funds to drive this, because it's a complex area and you need to understand it. So I'm a physician, and when I studied medicine, everything was done on paper, and at home I played with my computer, and I realized there must be some better ways of doing that. And so I was always in parallel to studying medicine, working in a healthcare, health IT startup. And, but it was interesting because what they did initially was helping documentation and so on, but what was much faster progressing in their business was the additional stuff like networking and encryption technology. And suddenly this company steered off outside of healthcare because it was much easier to accelerate and grow there. And so I ended up studying and practicing medicine and radiology for 5 years, because that again is close to technology, which really is the interesting field. And I left patient care because I realized that you have much higher level of possibility to influence things and to innovate things with technology if you're really actually doing it as a physician to make a change. Worked in startups and brought platforms to the market because we realized it's important to have some basis and standards and build on that. And so I ended up at Microsoft, which was an unusual company at that time for healthcare. Was a medical director for Microsoft for region Europe for some years. And later on also developed new business models around patient recruitment and rare diseases. And that was the time when I realized a lot of these business models somehow circulate around a molecule and somehow attach with pharma. So it's just a question of time. And in 2019, I joined Novartis at the head of digital innovation for oncology for region Europe, which was really an interesting piece because we brought innovation in to help our brands, to help our physicians, our patients to be better. And yeah, now in February, I switched roles, and that was partly because of my past, because being so close to startups, I was on a jury for a startup venture cup, Science for Life, for 10 years. And so I've always worked with innovative companies. I think it's really inspiring. You learn a lot, and it's really the differences between a huge pharma company and the small startups. I think that's something we will also discuss today. And so I was really glad in February I joined DRX Capital. And just a few words about DRX Capital, which is the health tech venture fund for Novartis. So Novartis actively invests in startups, typically Series A or B. So they've somehow proven their business model. And we help them to grow faster and achieve milestones faster that are relevant for our patients, for physicians, for anything along the value chain of pharma. And there we co-invest with others. So we contribute with investments, but we also contribute with a strategic work together. So with real business challenges that we see for our stakeholders, and we work together, which I think is really an interesting aspect, and I'm learning there every day. I'll stop here.
Thank you very much for the pitch. I think we had quite some introduction here. Maybe I would like to continue with you, Steffen. And I know this has been reiterated a lot in most of the panels, but we cannot really emphasize enough, I think, the importance that the COVID pandemic played for the acceleration of health tech in general, and the adoption or the meaningful adoption of innovation in general in the healthcare and life sciences. So basically, after the pandemic, new promising health tech startups, companies provide also new highs for investment too, right? So in addition to investment and invested capital, there is also a number of exits and fund projects that's also quite increasing currently. Maybe this question plays for each of you, of course, but I was thinking about, Steffen, how does the Swiss capital market react to the digital transformation of healthcare and life sciences in this extent?
Well, I'm probably not the best to talk about the capital market in Switzerland, and probably you, Christoph, can allude there more, but it was interesting to see how things immediately moved to online, but not everything stick. So it was really important to not just put something on the cloud or online, but it's really important to provide a value that people not just tell you, oh, that sounds interesting, I would like to use that, but that they actually use it and that it's embedded. I think it's all about the ecosystem and how you connect it. All the standalone solutions have really challenges in how to get traction and how to scale. And so I think it's really about with whom do you partner? How do you make sure that you have all the stakeholders on board? And so while the pandemic somehow was an accelerator for a couple of things, the natural laws of physics are still there. You need to provide value, you need to know your stakeholders, you have to have a fantastic product. That's the number one thing, you have to bring your team together. So this is not changing. It was just a period of acceleration.
Absolutely.
But if I may add to this one, I think that's probably the only good thing about the pandemic we just saw, that it actually pushed forward the adoption of digital health solutions like 5 years ahead, because there you saw you need to do something differently than you did before. Like the current healthcare system had been broken, you had to focus on decentralization of care, you had to work with telemedicine solutions because you couldn't just meet physically as you could, so that drove a lot of innovation in that area. And I think as soon if you have an area disrupting, innovating, as you just said, there were too many companies coming and just focusing on a new technical solution without really thinking through what is the ultimate business model, what is really the product market fit, what is the pathway to profitability, that somehow start to learn, like companies thinking about it like half a year ago, oh, actually there's something else than increasing revenues, actually where's my pathway to profitability to stay in the market for long. And I think that is now the change we are seeing in the market.
Absolutely. And adding up on that, what do you think is the current attractiveness of the health tech sector for investors right now?
We're just at the beginning of the trend. So it's a fundamental shift in healthcare. It's actually overall a very traditional, old-fashioned industry. And as you already, the two of you mentioned in your pitch in the beginning, there's a lot of hospitals where working with paper is still a common standard. And so when we speak about digitalization, it's other areas like banking industry. They started 15, 20 years ago with this disruption. And in healthcare, it started maybe 10 years ago. And so that's clearly the pathway for the next 10 years at least that's going to change. Also, when we speak about growth rates in the future, health tech is expected to grow around 25% CAGR from now until 2030. It had growing even a bit stronger the last 6 years, but it's definitely a market within healthcare overall that is growing fastest and also able, via new technologies, to really provide better care at lower cost.
If I may add here, I think there are many trends around in healthcare for which health tech solutions are vital over the next decades. For example, the demographic development. We have already today, but it will be even bigger in a few years. Demand and supply. We are getting older and older. On the other side, we have staff shortage already today. For us at Redalpine, it's clear technology can help to decrease that gap. Secondly, I believe, patients today are not only patients anymore, they're also consumers, and they expect Amazon experience. and in some ways, and to some extent at least. And yeah, again, technology can provide that. And also, furthermore, I believe the due to the rising costs, we see shifts from inpatient to outpatient care settings. We see a push for from fee for service to value-based healthcare. We see buzzword personalized medicine, and for all those approaches and trends, I think technology, connected devices, diagnostic solutions which can be applied at home will play a vital role in our view.
Absolutely. I couldn't agree more. And this leads me actually to the next question. And I'm wondering, are health tech innovators and health tech investors focusing on the same thing, or is it still a game at play which you as investors have to play along?
Well, I think if it's focused on the same thing, then you have a match, and then the companies, the inventors, found a fund to invest in. And I think where is really the right match, that depends really on specific company. But speaking, for example, from our fund, when we have identified a company that works on a disruptive novel solution with a proven product market fit, and really have a solution that provides better care at lower costs, bringing innovations ultimately to the patients, then we are very excited about the company and try to bring it forward. And if it's too much focused on a consumer space, then there are probably other investors better than us, because we like more resilient B2B business models when we look at companies.
Right.
And I think you shouldn't categorize, from my point of view, that's good or that's bad. It's just a different type of matches possible, I would say.
Absolutely. And as a founder, that's the, let's say, the goal, to figure out, who's the right investor for my company.
Right. How is this for the DRX Capital?
Exactly the point. I mean, already in the pitches of the different funds, you heard how they focus on different stages also of the company. So I think one thing that founders should really understand is, what type of investment do I need at this moment? Where do I want to go with that? And who is the right fund to work with? So really picking very carefully with whom you work, because the relationship can be a very intense one and a very good one, if you plan correctly and if you have a good match.
What is the best way for them to navigate this pathway then? Looking at things from the other side of the table.
I think it should be from a company's CEO perspective, like a daily business activity, to think about who are actually potential new investors, how can I ensure that I'm providing the right information or updates to potential new investors, to understand what their needs are, and to stay in good contact. So ideally, you establish it like at least half a year, better a year, 2 years ahead of potential investment, a good relationship to an investor, that he can move fast when you need him as a CEO. And another very important element is also, you need to be very, very persistent. Everyone tells you why something is not possible and you cannot do it. And you need to believe in yourself and the company, and then say, okay, how can I make it happen? So don't take a no for an answer, but then find the other ways around it. And I think that's the way to succeed.
I love this. I think we should quote this in the further reference to the open mic next in health series. Don't take no for an answer. I think that that statement speaks for itself. What are the advantages of the sector-focused funds? I'm wondering if there's any of you who would like to take the mic, the first mic on this.
I mean, that's an obvious one, because if you really have to understand the area, because it's complex and complicated. It's slower than other areas. You need to prove a lot more things than in other industries. So investors need to understand it, otherwise it's going to be a frustrating experience. So really this expertise of the market is required for success.
And you can really cluster your entire company organization around that vertical. From also we have our own medical doctors, data scientists, tech investor and health investors, and that's basically the complementarity you can bring to the table, as well as if you invested in 15 companies all in digital health. Not every problem or challenge a company has is different, so They all have issues how to scale up in the US, how to scale up across fragmented Europe, how to deal with price erosion of DIGA, for example, and how to incorporate those in your business models. And when you have a couple of companies already in that space, you can draw actually a lot of synergies from your portfolio in that area. And obviously, as an investor, you also don't stand still. And if you have 18 people working on one sector or 2 or 3 people, it's quite a different, because everyone is also analyzing companies, working on trends, working with our portfolio companies. So I think that's, from my perspective, a clear advantage for a specialist fund.
Absolutely. And we see this trend more and more often actually happening, at least since the boost of the health tech in general, since we can compare with fintech. On the other hand, you mentioned before banking, it's a completely different thing. You see lots of business people with general knowledge who join that and make a fortune out of it. And it's still good and it works because you can break things. But again, talking about healthcare in general and investment in life sciences solutions, life-changing solutions, it's a different story. Important thing to mention, most of you know, the ones who know Basel area in general and DayOne, when we talk about health tech, we refer to technological solutions encompassing on one hand side the highly regulated medtech market, and on the other hand side the gray area of digital health, how I like to call it, where innovators and regulators are still figuring out actually how to collaborate with the different stakeholders and standardize reimbursement, if we are about to dive into this topic. I'm wondering, what does this mean for venture capital and growth equity firms in general? And actually, in a previous conversation we had, Christoph, we discussed about the MTIP's vision actually to invest in health tech growth as leading capital investors, and that you place your bets on European health tech companies that aim to revolutionize global health. I like this part a lot. I'm wondering, how adventurous is it to invest in digital health nowadays, also when comparing with medtech? Given the regulatory pathway.
It's quite similar to what we discussed actually before. And I think it's a fast-growing market, growing more than 20% CAGR year over year. And obviously what makes this market now a bit more turbulent, let's put it this way, is the regulatory force coming into play. And we need to hope that it's not similar as the MDR regulatory regime, which started to be actually a help for European companies to get accreditation faster and easier, and became a monster which is now very uncontrollable. And if you have delays in getting a CE certification, a lot of it is not someone's fault, it's just because it takes so slow that it's not yet properly in place from my point of view. And we need to carefully manage and watch out that it doesn't have too many negative effects on the industry. But on the positive side, you obviously need some regulations in place. So I think the intention is obviously good, and let's hope that politicians and government bodies are able to do a smart way of putting the right amount of regulatory frameworks in place without destroying the innovation to that extent. But for a company, you should look at a European lens. Every European market has a different regulatory sub-regime, different payment models, and understand each market, understand how your business model can succeed. And I think then you get there. And if you understand it, which is easier from a European perspective to do, specifically living in Switzerland, which is not the largest European country, there you need to think about, okay, how is it working in Germany and France and UK and other areas, and which is also, from my point of view, quite a distinctive advantage compared to US. There you have just one homogeneous market, and as an American investor, they don't understand Europe. They say, wow, Switzerland, well, it fits into a suburb of New York. Why should I look at this country? And then how again to the other countries? That makes it sometimes more difficult than across Europe.
For digital health companies?
For investors, look for health tech companies as well. So American companies also like to acquire companies in Europe rather than building it up itself. So it's just a different market, but I think I'm obviously biased, a highly attractive market, Europe.
Exactly. I completely understand that. would you like to add anything? Maybe Daniel from Redalpine, how's your experience with this?
Yeah, let's say we at Redalpine, we like to invest in regulated products because, yeah, it kind of builds a moat for competitors, clearly, and yeah, understandable. And secondly, when talking about or when looking at digital health cases, we also like companies where, let's say, we see, usually we invest at seed stage or around seed stage, where the going to market strategy is still to some extent kind of fuzzy, and we then come in and work together with the company to build a proper going to market strategy. And at this stage, we usually like cases and companies where we see several potential routes, and yeah, where you have fallback option if you have a delay on one route, or you figure out that it's impossible to go to market through that yeah, route. Yeah.
Exactly.
Yeah, in
the life
addition
sciences.
to what you said, is I think there are also some aspects that that are true in healthcare, like in other areas. So as anybody of us will have a contact with healthcare in a certain point of his life or her life, you experience something where you say, well, when I ordered something online last week, that was easier. And so there are a lot of ideas on how to improve the processes, but the challenge is ideas alone are not enough, but it's really on how you implement those. And really there, the tenacity and also the understanding of how to bring things to market and how to scale to make a difference, I think, is really crucial for founders. And that's something where we take a closer look at on how, what was your plan, how have you implemented so far, and then we together extrapolate where do you want to go and how do you plan to implement that and work on that together, relevant for our fields, where we can then contribute also the reality check on what works with pharma and what should work but sometimes doesn't work yet.
Right, right. That's actually a good point. And I'm thinking mostly for MTIP and for Redalpine. Would you say that are you more risk adverse, or is it in general the trend in investment more risk adverse to investing in digital health than medtech, or is the paradigm shifting? Are the trends shifting?
Yeah. Well, in general, we are a conscious risk taker. That's part of an investor's attitude. In terms of sector, we clearly preferred and chose health tech compared to classical medtech, so if it's only hardware related. Reason being because in classical medtech companies, you have a lot of regulatory hurdles and risks associated to it, which, as I mentioned before, are not really controllable. So it can easily take much longer. It is much more capital intensive than if you look at today's times. You even need to bring the companies to a much higher revenue level than you used to. And some years ago, it was sufficient to bring them just until CE or FDA certification before being acquired, or sometimes even on the way to it. Now, a lot of potential acquirers do want to see initial revenues and also initial market traction, and to then potentially acquire a company. So the time to market and time to exit from an investment perspective gets longer and longer, capital intensity gets higher, and unfortunately in the same time, the value add, value increase isn't there. So you get the same exit potential as you had some years ago, but it takes much longer, it costs much more. So from an investor perspective, it's unfortunately less attractive than digital health.
I understand.
Yeah, as mentioned in my intro, for us, medical devices are part of the health tech investment focus, but for us, medical devices mean, yeah, connected devices. I think Redalpine would not invest in, as you mentioned, Christoph, in implants or knee implants of the latest generation. We'd like to have some software component as part of it to build on top a digital business model, which then allows to, yeah, hopefully scale. Yeah.
I see. And if you would be to, or also both of you, if you would be to think about what are the current hurdles for digital health companies, health tech companies, let's put it this way, in Switzerland, in Europe, And how does it compare to other parts of the world? Christoph, you mentioned before the US and the comparison with the US market. There's a lot of movement also in between these two markets, but let's not forget also Israel. It's a very innovative market that attracts a lot of talent, attracts a lot of innovation and creates a lot of innovation. Then we also have Asia with some countries that are quite advanced. From the go-to-market perspective and commercialization strategies up to the point of reimbursement. I mean, in Europe we discuss about DIGA, we discuss about DIHA. Where do we stand there? How do we compare in Switzerland with Europe, with the rest of the world?
Well, I think we can speak like days to answer, or try to answer it. But if you focus on some highlights, in starting from what I said before on the fragmented European market. So you need to have business models that work or can be modified easily depending on local requirements. So they're understanding how the regulatory frameworks work and how that fits to a universal business model is very important. Then if it's, in brackets, only a DIGA play, then clearly start with the German market, and then now it's moving over, you get a DIGA, it's called differently in Switzerland and France and the Nordics, so it's spreading around Europe as well, and move then alongside the new regulatory framework. If you compare yourself with your innovation against US or Asia or Israel, I think that's a key topic you should do before you even start a company. No one is waiting for a new innovation, so is it really top-notch in terms and international, on an international level? And I think in Europe, it's even, if you look at the patent applications, or patents granted, it's more innovative compared to the US. So actually Europe is leading in that area. It doesn't lead in terms of commercialization, where clearly US is ahead of it. But you have great minds across Europe and the less capital, unfortunately. So that's one reason why a lot of founders go early on to the US. But if you stay in Europe, then initially it might take a bit longer to find the right investors to get you there to a successful pathway. But then clearly you don't need to shy away from other markets. And if you look in Israel itself, they have different issues. It's a very small local community itself. They have a lot of initial Israel investments until Series A, but thereafter not a lot of international funds do invest in Israel, because it has then again other difficulties, let's put it this way. So there the common commercialization strategy is start in Israel and then latest with Series A, move on to the US to attract additional investors there. And that's a pathway in Israel currently, because they didn't manage so far to have sufficient funding for companies even at a later stage. And in Europe it's still not scarce, but at least speaking amongst investors, we are all collaborative competitors, because the market is still much larger than investment amount. So it's, I think with all of you, we compare notes sometimes on deals and even speak about potential new hires. It's a small market, so you know the other investors, and everyone knows sort of where the sweet spot from the other investor is. So that's quite interesting from our point of view.
Absolutely.
We have a common interest in helping the companies grow. I think that we can really
absolutely, yes.
That really brings us together.
Just one comment from myself. I just believe that the entire ecosystem in Europe is less mature, for example, than the US ecosystem, obviously. But it's actually interesting to see. We did kind of internal research and looked at health tech founders and compared health tech unicorns from the US with other parts of the world, including Europe, and how many companies these guys have founded before they basically built the unicorn. And they have significantly founded more companies in the US than in Europe or in other parts of the world. And I think in a few years, we will be at the same level, I expect, or hopefully.
How many years would you forecast?
Wow, very good question. 5 to 10 years?
I would say.
What is your bet? Same?
I would say it's the same, actually, yes.
That's good. We also reach an alignment. We like that. Maybe a more controversial question now, since we're talking about the US market and how more or less risk averse they are in general as entrepreneurs. How does the Silicon Valley situation influence the health tech investment market right now?
You mean the Silicon Valley Bank or the Silicon Valley?
The whole financial situation.
So it could actually become quite interesting. It's still it was a very clear, unbeaten hotspot for tech entrepreneurs, also health tech entrepreneurs. But speaking to some friends living there, it's actually now not as attractive as it used to be. You get also obviously inflation. You get latest with Silicon Valley Bank also a shock in the market. Maybe the sky isn't the limit. Maybe there's also something not working not so well. So a lot of international younger founders, companies actually relocate to other areas. So it's clearly still a dominant market, but we don't know how it's going to be in the next 5 to 10 years. There might be other areas, other new hotspots emerging on that dimension. So that's my assessment.
It's nice to hear. So there's a window of opportunity there to further explore, maybe even for the pharma companies.
What we also see is in parallel with the COVID pandemic that also companies became way more flexible. So I spoke with a couple of startups, and they initially they had rooms and they brought their developers in, and nowadays that's no longer the case. They say, well, we hire whoever we get, and wow. Across the globe, and as long as it works time zone wise and from the culture, that's how we work now, and it works better than we have thought before.
Wow, that's amazing. Looking at the small changes that actually have such a big impact. We were talking over the lunch break about partnerships and the importance of multi-stakeholder engagement in general. This is a topic very close to my heart because we cannot emphasize enough how important it is for startups to understand how to navigate the full health care and life sciences ecosystem. We know it's so complex in comparison with other sectors. And in business and more in healthcare, we talk a lot about strategic partnerships. And I was wondering, what does it mean to become a strategic partner of an innovator or healthcare startup for you as investors, for MTIP, for Redalpine, for DRX Capital, Novartis, more than becoming a shareholder?
I think it starts probably with the philosophy when we like to see ourselves as the sparring partner of the entrepreneurs, of the senior management team. We want to establish a level of trust that it's very easy to pick up the phone to call the CEO, CFO, or whoever in the organization, and vice versa. So it's in some cases it's maybe like every other day speaking to someone if there's a transaction going on or working on an important negotiation. And I think that's the or the working relationship attitude we'd like to have. We believe we have a good opinion. We believe we know within our team where we can help and how we can best guide the company. And if we can do so, we'd like to put it to use.
Right. What about Redalpine and your experience, Daniel?
Yeah, I think I just have to agree here. We also consider ourselves as a sparring partner and do everything we can to help founders, management teams to solve the challenges they face. And sometimes we have the expertise in-house, otherwise it's likely that we have someone in our network who has solved that problem before, and we can guide the company to that person. Yeah, that's let's say our approach.
Absolutely.
Yeah. For us, it's really the bread and butter. That's why we invest, because we want companies to grow, to solve our problems, the problems that, or the challenges that our businesses face along the whole value chain, from research until the product reaches the patient and supports the patient. And there it's really the partnership, because we're extending. It's not a normal vendor relationship where we buy a service or a solution or in-license something, but where we together identify a growth area where we say this would be great if the company with the capabilities that they have, if they extend it to help us solve this issue, which is really of relevance for our business. And then we work together to get there. But just as you said, it's not a one-off. It's not that we speak once and then the thing rolls. It's really a partnership that develops up to the investment and then continues to develop over time to really make sure that Novartis stays engaged. Like other companies, we're relatively large, and so it's for small startups, it's sometimes a challenge to work with a large corporation. And so we from DRX Capital help them a bit navigate and connect the dots behind the scenes to really keep this engagement going and make sure that they are successful. And success, and there again comes the ecosystem thought, means that they can afterwards sell also to our competitors in the future, because only then they will reach the patients, they can really contribute the value.
Absolutely. I'm also thinking then you play, or you think that collaboration in terms of your startups plays a very important role, I understand. And how, or what would be your advice for, or what is your advice for the startups that you're working with, that you actually invest in as part of your portfolio when it comes to collaboration with internal and external stakeholders? I'm just going to make a small bracket here. As I heard also from my days of pitching, not as an investor like you did today, but as in the ventures I have been engaged with. And I remember so often you're trained by mentors and coaches, and you hear, well, investors don't only invest in brilliant ideas, they invest in teams. So basically you put your bets on the team that's behind the idea, looking at the constellation that actually brings the idea forward, and it's able to keep moving. So now back to the question, what's your advice? How do you work? What do you train them to actually do in terms of internal and external stakeholder collaboration?
As we typically invest when companies have already proven their business model to a certain extent, there's not this level of training usually is no longer needed. They already are in a stage where they know how to pitch, where they have proven that the team works together and that they function and that they can implement ideas. There it's more about how do you implement in new areas. So you know this part of the business and you want to grow also in that part. How does that part work? What does change and how do you adapt to that? So that's typically where we help. But from the basis, that of course is true. So the team, how have you shown that you implement? Also where you pivot, and I mean that's still true.
Do you look also at the team dynamic, and also from the MTIP perspective, Redalpine perspective? Do you look at the team dynamic? What has changed at the point when they become more mature to your door?
I believe it's important for every investor. So it's also a team you will be working alongside with for a couple of years in the future. So if you cannot stand each other and it's always difficult from the beginning, it's probably not the right fit. And in terms of advice for a CEO, a company to give, I think I would probably say be very authentic, and you don't need to bend yourself for every little stakeholder. Obviously, you need to be very fair and you need to be open and a lot of time go the extra mile. But if you, so one message you shouldn't communicate totally different because of the collaboration. Everywhere the market is too small, it will fall back on you. But and otherwise, it's treat people like you would like to be treated. And I heard, for example, I was actually to some of your colleagues when portfolio company that didn't even get back and didn't even answer when trying to speak about the due diligence. Okay, obviously you didn't do your due diligence on him, and that's obviously a no-go if you are a CEO and there are some respects, even if you just had a round closed, you should always keep the door open, because also investors speak amongst each other. So but that should be common basic knowledge how to cooperate amongst human beings.
Absolutely, but we all know that from theory to practice, it takes a long way.
It is, yeah, and also understandable. We are all under pressure very often, but still take an extra step just to think through what is now the best approach.
Exactly.
Yeah.
Daniel, you wanted to add something?
Yeah, just one comment. We also usually don't like to see just a snapshot before we invest, we call it, we want to see a movie. And this means we'd like to engage early on, although we know that the company is likely too early, the product development stage is not meeting our investment criteria, but we like to engage, to meet the team, to see the dynamics, and then also have several follow-ups ideally before the company comes to a stage where it might be a fit for our fund. And through this approach, not only we have a much better idea about the team, about the progress, about the dynamics within the team, can they basically commercialize or sell the product, but vice versa as well. They understand, who is Redalpine, who are we going to work with if we sign a term sheet, and this then usually helps very much when, especially in competitive deals, because we just have a much better connection and have had, both sides have more data points about the other party.
Absolutely. And if you would be asked, what are the capabilities that health tech investors need to succeed and secure funding?
Investors or
health tech investors?
Health tech innovators.
Innovators. Well,
you can take as a personal example from MTIP or just as a general question if you would like to.
No, I'm actually just thinking whether it's so special just for the health tech industry or if it's not actually applied to every company trying to secure funding. So obviously you need to have a very compelling product, company, addressable market, and you need to present it in the right way and to think through it from the eyes of an investor. What would he like to see? He would like to understand early on what's actually the company doing, what are the USPs, why should I look at it? What is the market, what is the problem to solve, how is it solved, what are the competitors looking like, how do we do it in terms of capabilities within the team, do we have everyone in place, what is our setup regarding former patents to protect ourselves, etc. Those are the just classical information you would expect an investor to see, prepare them in a way that it's easy to digest, that it is gives a good overview in the beginning. And before approaching an investor, I would ensure to have the data room and the key documents and typical questions already prepared. And if you speak to multiple investors, everyone has different questions, different topics, and that will be, you will be stretched too much to try to answer everything for an individual investor. Which, by the way, is actually exactly the same for a fund like us. Not you, but for the independent funds. When we do fundraising for us, we also have investors investing in us, larger asset managers. It's a same drill. We need to prepare our pitch deck. We need to prepare our data room. It's exactly the same way. And that's, I think, a perspective you should spend sufficient time early on before actually approaching investors and pitching to them.
Oh, that's very interesting to hear that you're also pitching often. I think the startups are going to be very happy to hear that as well. You wanted to add something, Steffen?
I would like to build on, I agree, and I would like to build on something you said earlier, and that's the balance between your vision and the market reality. Because to a certain extent, your vision is something new. You want to bring something to the market which is disrupting a certain area, disturbing some players in the field. So at a certain point, you will not meet a lot of love for your new innovation. And so a lot of people will tell you how to change. And so, but you have to be persistent to get the disruption to the market. On the other hand, you of course have to listen to the market, have a chance to get the disruption to the market. And this delicate balance, I think that's really the challenging part, especially early on when you try to find your niche and your space for your disruption, which I think is really interesting, because listening is important, but it should not really divert your thing into something which doesn't matter to you and to the market anymore.
I couldn't agree more. And as we have to lean towards the end of the open mic closed conversation and open the mics also to the audience, the online and on-site audience, I just have
open mic closed conversation.
Exactly. You see the paradox? That's what's happening here. And then we're shifting towards our audience here with us on site in Basel and also the one online joining us online. But I have two last questions actually. I was wondering, because there's this trend that we all know about impact investing, and some are more familiar, some are less familiar. We know it's derived from a different sector. Now we're talking about impact investment in healthcare as well. I think it's a very nice, it's a particularly human side of the acceleration of digitalization in general in the sector that we're approaching also here, and health tech. What is impact investing in general? Are impact investing and sustainability indicators for successful investment for your organization? Are you looking at these elements when you invest?
I'm happy to kick off here. So for us, it's actually a very important requirement, and we started early on when the new regulatory framework, also there you get a regulatory regime from SFDR Article 9 being classified as a so-called impact fund, and which was in March 10, 2021 when this regime came into force. But in the beginning we on purpose didn't actually market ourselves as an impact fund, because there the market connotation was still, if you're not able to deliver performance, you call yourself an impact fund or focus on this area, which is exactly how we not wanted to be perceived. We believe it's a strong enabler to create long-term success and value, and that's what we want to do with MTIP. We want to empower innovation that improve lives for human beings in the companies we invest in. And we feel if you have a robust governance framework, if you have also a framework focusing on social aspects and ensuring that the company is there to stay for the long, it's actually a huge value driver also in the future for the companies. And that was the reason why we started to actually be also in the forefront of this regime, and we actually even now further developing it. We are just soon to announce our impact tool, what we want to see with companies even prior investing, what are the key criteria we develop together with the companies to further develop during our investment period. And so far we've actually made very good progress with our companies, and also received good feedback, and also believe it helped our companies to create value.
Nice. That's lovely to hear, absolutely. And this leads me to the last question, and it was actually the first one I think I asked also the audience, but now directing to all of you. Health tech investing, is it a boost or is it a bust?
If I may start, so given the complexity, I think it's a must for many companies, and because the time to bring something to market simply takes longer than in other industries, and so investment is often the option that you need to succeed.
I like that. So you just, I think we should just change it in the title as well, instead of formulating as an answer. But I would thank you so much on my behalf. Now we're moving to the audience, which is probably very eager to ask any questions, and for that I thank you already to my colleagues Lea and Rachel, who are going to mingle through the shy audience to address any questions. If I may encourage the startups, even so, it doesn't matter, but that's the moment.
I'm very interested to understand how you manage the balance when you have strategic collaboration to let the startup develop and innovate without influencing them with, for example, a certain culture. And I'm thinking more like the investment between corporate pharma and smaller company.
That's actually a very good question, but when we work with a startup, we typically don't incorporate the startup. We work with them on a specific project, and then you don't have the whole Novartis working with them, but it's a very small, dedicated team, which typically moves then also a bit faster. So that's how we see that. Culture-wise, we wouldn't really. The culture needs to fit to a certain extent to be able to work together towards a common goal that is not yet there. It's quite different from we purchase a service from a startup. But it doesn't go that far because we don't have the intention to buy or incorporate the startup. So the cultures can be also a bit different. That's for sure.
That's great. I'm going to jump now to an online question so that we don't neglect our online audience. We have quite a few. So we have a question that says, what percentage of your investments focus on femtech? As male investors in a male-dominated area, do you believe there is a biased blind spot towards femtech?
Mm-hmm. Well, I think I can answer out of 7 companies. We have one from the latest fund. We have one investment in femtech, in Apricity. That is actually a virtual care clinic helping couples with difficulties in conceiving. We have also internally close to, I think, 65% females at MTIP, also on senior levels. Actually, we're not really well balanced, so it's actually overshooting on the one side, but try to not only have diversity in the team, but also with companies to invest in. And femtech is and will stay a very important vertical, and there will be likely more companies to come. But that was one portfolio company we got very excited about and invested in August last year. And it's still an earlier stage of development for companies, but it's definitely a very exciting, interesting market.
From my side, if I may add a comment, we have been looking intensively into that space, but we haven't found yet a seed stage company from Europe which fits our investment criteria. Diverse team, great product with a moat, and also a solid and robust business model. I unfortunately have to say we haven't come across that company yet, unfortunately. Mm-hmm. But if there are femtech founders around, please apply at Redalpine. Yeah.
As a focused innovative medicines company, we have certain therapeutic areas, and one of that is breast cancer, which is a very active area for us, where we do a lot of work with, also in my previous role in digital innovation, we worked with a lot of startups in that area to help women with breast cancer. So it's a big topic, but we are somehow, as strategic investors, also close to the topics that our business is about, and so some of the femtech areas are not in focus.
Right. Yeah. That's quite challenging, I guess. Do we have any other questions from the on-site audience? I encourage the startups not to be shy. Mm-hmm.
Hi, sorry, not a startup, but just wondering if in your modeling or as you look at the landscape for future investment, how you see generative AI might be changing that landscape. Are there certain sectors that you predict will be growing faster than others?
So I think AI applied to health tech also internally from a fund perspective, if that was a question, it will also there have a huge impact. I think it came out today when we announced it after working 2 years for our internal AI-empowered solution called Trailblazer, which supports us in making more unbiased investment decisions and also providing a lot of analysis, outcome predictions of potential new investments, competitors, companies, to increase the likelihood of success of our investments. And that's one thing what we do. Also, some of our portfolio company actually use already now the support from ChatGPT in terms of making their solutions more efficient, basically. Obviously, you need to do a sanity check in between, so you cannot really fully rely on it. But it's a topic that is going to evolve, and it's another disruption which is just emerging. And it's only very limited solutions on the market, but if you also look at the investment in that space and the new company being founded and formed, that's will have a huge impact and change on the entire industry. Not only health tech, also investments on every other industry.
I'm actually surprised that we made it until the Q&A without. But thanks for asking, Julie. It's a very relevant and hot topic these days. Coming from radiology, AI has been around for a long time, and if you look at the FDA-approved algorithms, most of them are in radiology because it's the data that you need to drive this in a meaningful way. And in radiology, the discussion, and maybe this will be repeated, and you already underlined it a bit, is, oh, will then AI take my job away? And in radiology, we've have the answer to that. No, but physicians who use AI will take the job of physicians who don't use AI. AI will become an integrative tool, and we may drop the term generative in the future. I'm not sure how this will all develop, and we're very, very early days, but it will change all. I think that's for sure.
That's a very hot topic indeed. Addressing now maybe the last question, depending on how many answers are going to bust into answering it. I find it quite nice. So one of our online participants is saying one difference between the US and Europe is the culture of learning from failure and recognizing failure as an important experience. And we have been discussing, Christoph, about the difference between the US and the trends. You did also a forecast, Daniel, about what's going to change and how long will it take. The question is, did you invest in founders that previously failed?
Clear answer, yes. And it was actually a very successful investment. It was one company, Blueprint Genetics in Finland. The founder failed with his first company. Then his second company was actually quite successful. The third company was Blueprint, were reinvested, which is now successfully sold. He's now working on his fourth company. We stay in close contact and might invest in one point in time. So definitely you learn a lot when you fail with a company, and it's not a stigma. However, that's unfortunately still a fair statement that in Switzerland or across Europe, it's typically seen more as a failure, as with a bad connotation, rather than, hey, it was a great learning experience. Now you know where the pitfalls, what to avoid.
Absolutely. I have to agree with that. I once heard also the same. It was actually an Israeli investor in the US saying, well, first we invest in the ones who had a business and they succeeded. Second, we look at those who had a business and they failed. And the last ones are actually the ones who never did anything about that. So that was quite rough, and we all thought, wow, this is really harsh. But with Christoph here, actually, it seems like it's really working that way. And we can just encourage more and more people to try, fail, stand up, never take no for an answer, circling back to the first line here. And remember, health tech investing, not a boost, not a bust, but a must. Quoting here, Steffen. Thank you very much to all of you who have been today with us at the Novartis Pavillon in Basel, but also to those of you who bared with us until now online. Once again, thank you very much for the amazing contribution to this panel, and hoping to seeing you all soon again.
Thank you very much. Thank you. Thank you.
Just saying a few last words. Thanks also from my side. Thank you very much to panelists Steffen, Daniel, Christoph. Thank you for sharing your insights in the industry and your experiences as investors. Thank you, Anca, for moderating. You're all invited to join us. The panelists will stay as well. Join us at the apéro. Have a drink. This was the first of 4 events this year. The next event is planned for the 12th of June on the topic of patient engagement. So stay tuned. Invites will go out soon. And we're hoping to see many of you in a month here again at the Pavillon. Thank you very much.